Hi, my name's Melanie Bryden. This is my practical assessment for my Diploma of Fitness with AIPT. I'm training my client Stuart today at the Heavy Metal Barbell Club in Ocean Grove in Victoria. I've organised all the stations for exercise. I've taken into consideration there's, I think, 3 other people training at the moment, so we're not going to be in anyone's way, and I've reserved the equipment. I've tested all the equipment, it's all ready to go and it's all safe to use, and there wasn't any hazards in the way, so we'll be fine to train today. So Stu, if you want to join me. How are you today?
Good.
So I've trained Stu before, so I'm just going to check on his health and his ability to undertake exercise today. So if it's alright, I'm just going to ask you a few health questions. So we'll quickly go through that. So just a few questions here. Have you ever had a heart attack, coronary surgery or a stroke?
No.
Has your doctor ever told you that you have heart trouble or vascular disease?
No.
Has your doctor ever told you you have a heart murmur?
No.
Do you ever suffer from pains in your chest, especially during exercise?
No.
Do you ever have pains in your calves, buttocks or the back of your legs during exercise that's not due to soreness or stiffness?
No.
Do you ever feel faint or spells of severe dizziness, especially during exercise?
No.
Do you ever experience swelling or accumulation of fluid around the ankles?
No.
Do you ever feel your heart rate is suddenly beating faster, racing either at rest or during exercise?
No.
Do you have chronic obstructive pulmonary disease, lung disease or cystic fibrosis?
No.
Have you ever had an attack of shortness of breath that developed when you were not doing anything strenuous in the last 12 months?
No.
Have you ever had shortness of breath develop after you stopped exercising at any time in the last 12 months?
No.
Have you ever been woken at night by an attack of shortness of breath in the last 12 months?
No.
Do you have diabetes? Do you have ulcerated wounds or cuts on your feet that don't seem to heal?
No.
Do you have liver, kidney or thyroid disorders?
No.
Do you experience unusual fatigue or shortness of breath when doing everyday activities?
No.
Is there any other physical reason or medical condition, or are you taking any medication which prevent you from undertaking an exercise program?
No.
Is there any other factors other than what we've discussed that might prevent you from partaking in exercise today? Okay, perfect. So Stu's already signed the health assessment form. So from those questions, he's okay to exercise today. So we'll quickly go through what we're going to, the workout that we're going to do today. So the fitness test that we're going to undertake is sit and reach, and the reason for that is Stu's been working on his squats and his Olympic lifting, so we'd like to improve his hamstring flexibility to increase his range of motion and help his technique with his squats and with his Olympic lifting. Then we're going to do 10 bodyweight push-ups, then we're going to do 10 overhand strict chin-ups, and then we're going to do 10 bodyweight lunges. So I'll talk you through each of those movements and when we get to them. Then we're going to do a time trial on a rower for 250 metres.
Yep.
Then we're going to do some cycle intervals, and that's all I'll require from you today.
Okay.
Now there's no limitations that Stu's got for any exercise, so he should be okay to do all of those activities. Did you have any questions?
No.
Okay, alright, we'll get started.